Hi, this is Dr. Katie McQueen coming to you from the beautiful La Hacienda Treatment Center and going to talk about relapse. The other day I was texting with a fellow traveler and she texted me this: relapse indicates that we are not living in a way which satisfies our basic needs. And it struck me as quite profound. I'd never heard it said in that way. And the first thing I thought about and heard of, basic needs, that is, do we have shelter and do we have food? That's our basic needs. And then I thought about what we teach people in recovery, never get too bored, hungry, angry, lonely, tired. And that's really true. When I'm in that frame, when someone else is in that frame, that certainly is an indicator that relapse might be on the horizon. I call that prelapse. And but then I dug a little bit deeper and began thinking about sort of my own basic needs and what I'd been discovering recently about my basic needs. And I came up with, for me, with four: love, serenity, connectedness, and grace. And I realized that when those things are present in my life, there's no place for alcohol or drugs or addiction or self-harm of any kind. And then I got to thinking, well, what puts those things in place? And what puts those things in place is meetings, fellow travelers, quiet time with my higher power, reading, writing. That's what put those things in that place. And then I got to thinking about, well, this should be a little bit about the brain, shouldn't it? I mean, you are a doctor after all. And I got to thinking about relapse pathways and how the challenge in addiction is that a pathway's been created that hijacks our pathway that's supposed to tell us this is your basic need. And it deludes us into thinking that alcohol or drugs or something else is our basic need. And so what we want to do in recovery is extinguish the pathway that says alcohol, drugs, self-harm is going to fill my basic needs, and build up that pathway that says, I have these basic needs. For me, they are love, serenity, connectedness, and grace. And this is how I tend to those basic needs. And when I meet my basic needs, I'm sober, recovered, happy, joyous, and free.